Imagine being seriously sick or injured and having to decide whether to get medical help or fall into lifelong debt. For millions of Americans, this isn't just a fear, but it's an everyday reality. Many people delay or completely avoid medical access or care because they simply cannot afford it. As someone that deals with chronic illness, I've been privileged to have US healthcare, but at times for the cost of treatments, surgeries, and medications, this can be very expensive for those uninsured. In some cases, this can lead to worsening illness or even death that could have been prevented. Learning about the US healthcare system and seeing how it affects real families made me question why access depends so heavily on income and employment. Today, I want to persuade you that healthcare should be considered a basic human right because it is essential for survival, increases equality, and strengthens society as a whole. So let's begin by looking at why healthcare is essential for survival. Healthcare is essential for survival, not a luxury. Medical care is a necessity to treat illnesses, injuries, and chronic conditions. No one chooses to get sick or injured. These things just happen unexpectedly. According to the Institution of Medicine, people without access to healthcare are more likely to die from treatable conditions. As many Americans that don't have insurance, they prolong their physicals every year and they end up having diseases that they never knew they had before, and it leads to death a lot of the times, which could have been treated. Preventative care plays a major role in saving lives. The Center for Disease Control and Prevention explains that regular checkups help detect serious injuries or diseases earlier. Early treatment leads to better outcomes and fewer complications, which can ultimately save lives. So, let's start by talking about while healthcare is essential for survival, not everyone has access to it. Treating healthcare as a privilege increases inequality. Access to healthcare in the US is often tied to income and employment. The Kaiser Family Foundation reports that people with full-time jobs are more likely to have insurance. Low income or uninsured often delay care because of the high cost. Certain groups are affected more than others. The CDC has found that low-income families and racial ethnic minorities face greater barriers to healthcare access. These barriers contribute to long-term health and financial inequality that can last for generations. So with that being said, beyond fairness and equality, healthcare as a human right also benefits society as a whole. Treating healthcare as a human right benefits society economically and socially. Providing access to healthcare reduces long-term costs. Preventative care is far less expensive than going to emergency rooms, which emergency rooms are thousands of dollars just by one visit, not including the treatments that are given to you, the medications, or whatever procedures are done, or advanced treatments. According to the CDC, early intervention prevents costly complications later on in your life. A healthier population is more productive. The World Health Organization states that good health allows people to work, attend school, and contribute to their communities. So without good health, we cannot go to school. Without good health, we cannot go to work. Without good health, we cannot communicate with others within the communities. When fewer people are sick, there is less strain on the hospitals, public assistance programs, and even the economy overall. So, as we've seen, healthcare plays a major role in survival, equality, and the well-being of society. Treating healthcare as a basic human right would reduce suffering, improve quality of life for millions of Americans. No one should have to choose between protecting their health and protecting their financial future. Recognizing healthcare as a human right would move the US toward a healthier and more humane society.